Hi ladies! Today I would like to talk about an alternative to offering formula if your baby is not latching onto your breast in the first 24 hours of their life. Don't get me wrong, I agree that formula has its place, especially where medically indicated and where the mother chooses to do so with her fully informed consent. But formula doesn't always have to be the first choice for an otherwise healthy newborn infant born at term with a normal birth weight. Offering formula where it's not medically indicated can interfere with the establishment of breastfeeding, your milk production. It can affect the baby's gut flora and can have other health disadvantages. How would you normally expect breastfeeding to look like on day one? If you and your baby have had a healthy pregnancy and birth, your baby, if left in uninterrupted skin-to-skin contact, will most likely attach to the breast within an hour of birth. Babies are full of adrenaline after delivery and they're very alert, and this is an ideal opportunity for them for learning and familiarization with the breast. The next question you might ask, is there milk in the breast at birth? And the answer is yes. Colostrum is the early breast milk that's produced from as early as 16 weeks of pregnancy. It's very concentrated breast milk and it's full of nutrients and antibodies available in small amounts. It looks yellow and is quite sticky. And not all mums might be aware of colostrum production during their pregnancy, as they might not be leaking colostrum, but that's okay. Colostrum provides your baby with everything they need in the early days after birth. Your baby's stomach is only very small. It's only the size of about a cherry. So the amounts of colostrum that you produce are ideal for the baby's stomach size and also for the baby to learn to coordinate sucking and swallowing. Colostrum also puts a protective lining on your baby's gut and it has a laxative effect. So that means it helps your baby to pass the meconium, which is the sticky, tarry looking first poo. And the quicker your baby clears the meconium and the more colostrum your baby consumes, the lower your baby's risk for developing jaundice. On day one, healthy newborn infants take in on average about 5 mils of colostrum per feeding. This is a 2.5 ml syringe, so 5 mils of colostrum would be equivalent to 2 of these syringes full of colostrum. Babies tend to be quite sleepy on day one, so they would feed usually on average 4 to 6 times in the first 24 hours. This quickly picks up to 8 to 12 times in 24 hours from day one onwards, and typically babies wake up and cluster feed a lot in the second night, and they do a lot of breast stimulation to encourage milk production and for the milk to come in. Their milk intake per feeding increases quickly to 15 to 30 mils per feeding by the end of day 3. Sometimes colostrum is also described as baby's first vaccination or liquid gold. So wherever possible, you want your baby to receive your valuable colostrum. What if your baby is not latching onto your breast within the first 24 hours of their lives? So some of the reasons for not latching onto the breast on day one could be that you have had sedative pain medication during labor that's made your baby a bit sleepy. Also, your baby might have required oral suction after birth that has left his throat and mouth a little bit irritated, and therefore they might not be quite as willing to latch on and suck. Another reason could be simply a missed opportunity for learning, because your baby might have not received the uninterrupted or any skin-to-skin contact after labor and delivery, depending on how your labor went, whether you needed stitches quickly because you were bleeding, or just due to routine hospital procedures such as measuring and weighing the baby. Other reasons could be that you might have some anatomical challenges, that you might have flat or inverted nipples, or your baby might have a slight tongue tie, or even an undiagnosed cleft palate. Or you've just had a long labor and your baby, just like yourself, is exhausted and is slow to wake for feeding. Babies who have had an exhausting journey during labor, they cannot always be relied on feeding on demand, so they might need waking for feeding and a bit more encouragement to feed actively off your breasts. It is important to discuss and troubleshoot with your midwife or doctor who is looking after you in the postpartum period to find out what the reasons for not latching on might be, so that they can monitor your baby accordingly for temperature, skin color, muscle tone, whether they are easy to wake up, whether their breathing and temperature is normal, and whether they're passing urine and stools, so that they can refer accordingly if necessary. Your goal is that your baby eventually attaches to your breast and feeds actively and comfortably from your breast. To avoid unnecessary loss of energy, keep your baby warm but not overheated. The best way to keep your baby warm is to keep your baby in skin-to-skin contact with you. This also will provide your baby continuous access to the breast and will give baby plenty of opportunity to be close to the breast and familiarize themselves with the breast. The best way to keep baby's temperature stable is to keep your baby in skin-to-skin contact. Being near your breast will trigger baby's natural instincts for feeding much more than if your baby is tucked away beside you in the cot or even cared for by nursery staff. Feel that you're very tired and exhausted from labor and that you're not able to continue providing a safe skin-to-skin contact because you might fall asleep with your baby on top of you, do involve your partner as well. Skin-to-skin contact is great for bonding, and it's not just for straight after birth, but for the whole of your postpartum period. Expressing a little bit of your colostrum onto your baby's lips and tickling their nose and upper lip with your nipple can tempt a sleepy baby at the breast. If they're very sleepy and hard to wake for feeding, you can also use a damp cloth and wipe their face gently, and you can also massage hands and feet. As another way to encourage latch on, you can do a little sucking training with your baby. Ensure you've washed your hands so your hands are clean, so you'd offer your baby your pinky and you can stroke your baby's nose and upper lip and wait for your baby to open their mouth wide, put their tongue down and forward and your fingertip upwards towards the palate, and with a gentle stimulation you can encourage your baby to suck, and when they get into a regular sucking rhythm, quickly transfer them to the breast. Keeping your baby in skin-to-skin contact will also help you to pick up on baby's early hunger cues much more quickly than if your baby is tucked up in the cot beside you. Early hunger cues are something simple as waking, starting to look around, smacking their lips. Sometimes they bob their head on your chest. They will bring their fingers and fists to their mouth and start sucking. And that is the time you would want to offer your baby the breast. because if they're already crying with hunger, it can become much more stressful and latching is less likely to be successful. If the reasons for not latching onto your breasts are anatomical challenges such as flat or inverted nipples or even a slight tongue tie, try out different feeding positions. Don't stick to the traditional one only. Try to lie on your side or offer your breasts in the rugby hold or American football hold, as the different feeding positions might shape your breasts slightly differently. As you're lying on your side, your breast falls to your side, your nipple might be a bit pointier and therefore it might be a bit easier for baby attach on your side, or just simply lie back and try out biological nurturing. I do have a printable which I have linked in the description box below. It is available through my Etsy shop, which discusses different positionings at the breast. If latching remains unsuccessful, you will need to give your baby your colostrum in another way, and this is where hand expression comes into play. Because of the amount and consistency of colostrum, hand expression has shown better results than pumping in the first 24 hours after birth. There is a real-life tutorial on hand expression included in my online breastfeeding course, Breastfeeding Basics, a practical guide, and I've also linked a YouTube tutorial on hand expression in the description box below. Ideally, you should aim to yield and collect about 5 mils of colostrum when you're expressing for a feed. If you're not able to collect 5 mils at a time, do increase your expressing frequency. Breast milk can be safely stored at room temperature at 20 degrees Celsius or lower for up to 4 hours, and I've linked the storage guidelines for breast milk in the description box below. The expressed colostrum can then be given to your baby via syringe or cup as an alternative to a bottle to avoid nipple teat confusion. Also, the small amounts of colostrum would most likely get lost in a bottle. Syringe and cup feeding should be supervised and explained and directed by your healthcare professional. Delay offering a pacifier, as this could suppress early hunger cues. When you're giving your baby expressed colostrum through a syringe, keep your baby close in a slightly upright position. Keep your baby near the breast so they associate sucking and receiving milk with being close to the breast. Like with the sucking training that I've mentioned earlier, you can invite your baby to draw in your finger and start sucking on the finger. So again, they will associate receiving milk with sucking. And then as the baby is sucking on your finger, you would gently insert the syringe next to your finger in the corner of baby's mouth, not too far back, just so in the corner of the baby's mouth into their cheek. And as they are sucking, gently you would push in a very, very small bolus of milk. I guess because of the slightly higher risk of aspiration with syringe feeding, the WHO recognizes cup feeding as the preferred method where direct breastfeeding is not possible. Like with syringe feeding, you want to sit up your baby in an upright position, even more so than with syringe feeding. And then you would need a medicine cup or a special feeding cup with a spout and a soft rim, a soft edge. You fill it up half at the most, and then you will bring the liquid, the expressed colostrum, right up to the rim, but don't pour it into baby's mouth. Wait for the baby to put her tongue down and forward and start sipping the milk. And what you do it's quite amazing. They will lap up the milk like a cat. And that way they can get quite fast at drinking the milk, but keep the pace slow, allow pauses and time for swallowing. Continue to offer your baby your breast every 3 to 4 hours, or syringe or cup feed your colostrum until your baby latches onto your breast successfully and feeds actively and effectively. If your baby hasn't managed to latch successfully to the breast yet after 12 hours of birth, in the meantime you would have given them your colostrum, but still you would want your baby to be reviewed again to ensure there is no medical reason as to, or a more serious reason as to why your baby is unable to latch onto your breast. I hope that this video encourages you to persevere with breastfeeding, even if you're having a difficult start. My 22-month-old nursling has just decided to join me for the end of this video. So if you have had trouble latching on your baby, let me know in the comments what has helped you, or if you continued expressing exclusively. So otherwise, until next time, hope your breastfeeding journey is going well.